friends. Today we will be discussing some very common over-the-counter remedies for teething pain and oral pain that could be harmful and even dangerous for some of the most vulnerable members of your family. Recently, Health Canada issued a warning regarding some very common over-the-counter products that many parents and caregivers are accustomed to using for teething infants. These products are also commonly used by adults for mouth pain and mouth sores. The ingredient of concern is called benzocaine. Benzocaine is a topical anesthetic that is found in many oral preparations that may come in the form of gels, swabs, lotions, liquids, or creams. And some of the brand names for these products can be seen here. The concern here is due to a very serious condition that benzocaine can cause called methemoglobinemia. Methemoglobinemia is a serious blood condition that reduces the ability of red blood cells to deliver oxygen throughout the body. Symptoms can be weakness, confusion, headache, and/or difficulty breathing. This can happen to children as well as adults, and it can be fatal. Hemoglobin is responsible for carrying oxygen to our tissues, and if our tissues don't receive enough oxygen, they cannot survive. In this case, benzocaine can cause the iron atom found in hemoglobin to undergo a process called oxidation. When we have oxidized hemoglobin, this type of hemoglobin is unable to carry oxygen to the tissues adequately. Our body does have a mechanism called methemoglobin reductase enzyme. This ensures that the levels of methemoglobin stay below or equal to 1% of total hemoglobin concentrations. Methemoglobinemia can either be inherited, so genetic, or it can be acquired, and that is what we are talking about in the case of benzocaine. So in this case, exposure to benzocaine can cause what we call acquired methemoglobinemia. When exposed to the benzocaine, this type of oxidation can exceed the capacity of our body system to regulate the balance of this chemical. This can result in weakness, confusion, dizziness, seizures, and rarely even death. So it should be known that benzocaine-containing products should never be used for children under the age of 2. Children under the age of 2 are less able to communicate when they have symptoms of methemoglobinemia. Health Canada is quite concerned that despite this warning, many parents and caregivers will continue to recommend these products and use these products because they are so used to seeing them and using them in the past. Teething is a complicated time for both parents and caregivers. Be sure that anyone you know that may be a parent with a child under the age of 2 or that may have a child in their care is aware that benzocaine-containing products can be very harmful and should not be used for this age category. Ask your local pharmacist for some tips and advice on how you can get through the phase of teething safely without using a benzocaine product. Thank you very much for watching. Take care and stay healthy. Bye-bye. Methemoglobinemia. Methemoglobinemia.